Hi friends, I wanted to share with you some information that I find fascinating. So I want to answer the question, when do you know that you need to go see a sex therapist? There's a lot of people out there that we believe may be trained to help us with some of our issues, and so I just wanted to kind of educate you on who knows what and why. If you are having some issues in your marriage, maybe revolving around sexuality, and you go to a marriage counselor, it's a great decision. I always am an advocate for therapy, okay? But the truth of the matter is their program only required one human sexuality class, a basic class. It wasn't about dysfunction and it wasn't about sex therapy. So it's okay to ask and say, have you had any specific specialized training in areas of sexuality? If you go to a clinical mental health professional, which they are wonderful, they're working miracles, they were not required to take any sexuality courses in their master's program, okay? Same with a social worker. If they have a master's in social work, they were not required to take any of those classes, okay? Some individuals will come from the framework that, you know what, if we can fix the marriage, we'll be able to, the sex will take care of itself. That may happen sometimes. However, the studies show that if you have a sexual problem and it lasts for more than 6 months, the chance of it spontaneously fixing itself without sex therapy is really low. Also, we may think, you know what, if it's a female issue, I'm gonna go to my gynecologist, I'm gonna talk to my obstetrician. It's always good to talk to your doctor. Okay, sex is also a biosocial thing, which our biology, our hormones, that's all playing out. It's absolutely wonderful to get your hormones checked to make sure, you know, ask them if they see any reason for the pain you're experiencing. The fact of the matter is that gynecologists and obstetricians are only required to take about a 4-hour seminar on sexual dysfunction. Okay, so they can help with part of the problem, but they're not trained in sex therapy. If you're having issues with vaginismus or being non-orgasmic or those kinds of things, they're not trained to help you with that. Same with a urologist. If you're working through some male dysfunction, either premature ejaculation or erectile dysfunction or inhibited ejaculation, or you're going through a prostate treatment, all of that, the urologist can answer the biological questions. They can prescribe you something that will make blood flow to your penis, but they are not trained in sexual functioning or sexual therapy or any relational issues. So that's when you know you need to go to a sex therapist. If those are any issues that you are dealing with as an individual or as in your marriage, you probably need to see someone trained in sex therapy. Just some good information for you today. Thanks. Have a great one.